Guarding is the process of protecting a patient from falling. When a patient using an ambulatory assistive device is arising from a chair or sitting down, the therapist stands in stride to one side and slightly behind the patient. This position allows the patient to move without being blocked by the therapist. There are instances when it's necessary for the therapist to stand in front of the patient. When a patient is assuming standing from or assuming sitting in a wheelchair, the chair should first be stabilized. Make sure that the wheel locks are engaged and the wheelchair is placed against a stable surface, if possible. Footplates should be raised and the footrests removed and placed out of the way of the therapist and the patient. To make the assumption of a standing position easier, the patient should move to the front edge of the seat. The feet are then placed flat on the floor below the front edge of the seat. The knees will be flexed to approximately 100 degrees and the ankles will be in slight dorsiflexion. The patient's center of gravity can now be brought over the base of support quickly as standing is assumed. The feet may be placed either side by side or in a short stride position, which will increase the patient's base of support. When moving to standing with the feet in stride, the foot of the uninvolved lower extremity is placed slightly behind the involved lower extremity. In this position, the patient can use the uninvolved lower extremity for the rising motion. Placing the patient's hands on the armrests will increase the base of support as well as provide initial assistance to push to the standing position. To assume a standing position, the patient will need to lean forward, shifting his center of gravity over his feet. Extending his knees and hips to rise from the seat while pushing directly downward on the armrests, the patient rises to standing. Any push on the armrest other than vertically down may result in the patient being off balance. If the patient requires assistive devices for ambulation, these must be accessible to the patient both when sitting in the chair and after the assumption of standing. To assume a sitting position, the patient should be by the front edge of the chair and turned facing away from the chair. As the patient nears the chair, she must check that the chair is secure and, if it's a wheelchair, that the footrests are out of the way. Initially, patients may feel more confident if they turn towards their uninvolved side. The patient may place her feet either side by side or in a short stride, which increases the base of support. If the feet are in stride, the foot of the uninvolved leg is slightly further back than the other foot. If assistive devices are being used for walking, initially they should not be utilized for the assumption of sitting. The patient should hand the devices to the therapist, then place both hands on the armrests and lower himself onto the front of the chair in a controlled manner. If assistive devices are used during the assumption of sitting, one hand, usually the one on the side of the involved lower extremity, is placed on the assistive device and the other hand is placed on the armrest before lowering onto the front of the chair in a controlled manner.